Hello, everyone. Thank you for participating in today's Zoom meeting on Insurance 101, Learning the Basics. Today's guest speaker is Amy DeStefanis. Amy DeStefanis is a principal case manager with Sanofi Specialty Care and is a licensed certified social worker and certified case manager. She enjoys working with patients and providers to help individuals and families affected by lysosomal storage diseases gain access to care, treatment, resources, and support. Amy lives and works in Boston and has been a case manager with Sanofi for almost 5 years. She primarily works with patients living in North Carolina. Throughout the webinar, if you have any questions, you can send them at any time by clicking the Q&A feature at the bottom of the window. And with that, we'll go ahead and get started. Thank you very much. Welcome, Amy.
Thank you, Tiffany, for that introduction. Like she said, today we're going to be going over our Insurance 101 deck. And next slide, please. So like she mentioned, I'm a case manager with Sanofi Specialty Care. Sanofi's been in the rare disease space for over 30 years and is committed to improving the lives of patients. As part of our commitment to individualized support, your CareConnect Personalized Support Services case manager is here to help you navigate the basics of health insurance. Next slide. Today's topics will include discussions on the main types of health insurance coverage, things to consider when choosing a plan, open enrollment, qualifying life events, and the resources and support offered by CareConnect PSS. Navigating health insurance coverage and benefits can be complex. It's helpful to develop an understanding of your coverage options and the benefits available to you under the different kinds of plans to make informed decisions for you and your family. Next slide. There are 3 main types of health insurance coverage that we'll discuss today: group coverage, individual/non-group coverage, and government-sponsored insurance. Next slide. Group coverage is typically provided through an employer, either small or large, and the employer sets the benefits package and the plan options. Group coverage may also be sponsored by a union. Employer or union-sponsored plans may follow different annual enrollment timelines. That means that you could have open enrollment in the fall, it could be in the summer. It really just depends on the employer or union. COBRA, or the Consolidated Omnibus Budget Reconciliation Act, is a federal law that protects employees of companies with more than 20 employees. Many states have enacted mini COBRA laws to offer this protection to employees of smaller companies. Your state Department of Insurance website is a good resource for this type of information, and additional details about COBRA can be found on the Federal Department of Labor website. Strict timelines are in place for electing to continue your group coverage under the COBRA law. It's possible for people to have coverage under more than one group policy. In this circumstance, it'll be important to understand how those plans will coordinate benefits. And if you're ever in a situation where COBRA is coming into play with your insurance, it's important to notify your CareConnect case manager if you're already connected with them, so we can help you navigate that application process. Go to the next slide. So now we're going to talk about individual or non-group coverage plans. So these are private plans that are purchased by an individual for yourself or your family. These can be purchased through a health insurance marketplace. So you may be familiar with healthcare.gov. That's the typical website you would use to purchase a plan like this. And these are the plans that were made possible through the Affordable Care Act, or Obamacare as it sometimes is known. So people with no access to group health insurance benefits via an employer or a union have the ability to directly purchase coverage for themselves from an insurer directly or via the health insurance exchange. Some states have established their own health insurance exchanges, while others use the Federal Health Insurance Exchange website, healthcare.gov. The main difference between purchasing a plan off of the exchange versus directly from an insurer is that the health insurance exchange may provide access to premium subsidies for qualified individuals, and applying through healthcare.gov can help you determine if you qualify. Plan offerings through the health insurance exchange can change annually and typically require annual re-enrollment. Some states offer extended enrollment periods that you may qualify for a special enrollment period after a qualifying event, which we'll discuss later in this presentation. Go to the next slide. And then the last type of insurance plans are government-sponsored insurance plans. Medicare is available for individuals over the age of 65, or for those younger than age 65 with end-stage renal disease, or those who have qualified as disabled. For comprehensive coverage, some people may choose to purchase a supplemental plan to Medicare, which are known as Medigap policies, or enroll into a Medicare Advantage managed care plan. Those are known as Medicare Part C, as in cat. Medicare eligible beneficiaries are typically not able to purchase standalone individual or health insurance exchange plans. So that means if you have Medicare, you wouldn't also be able to purchase an exchange plan. You'd most likely be instructed to purchase a gap plan rather than a supplemental commercial policy. Medicaid is available for individuals who qualify via their income, or for people, including children, with disabilities. State Medicaid programs can vary in terms of coverage and benefits depending on how the individual state has expanded or not expanded their program. Many states require Medicaid recipients to enroll in a Medicaid managed care plan. That would mean that instead of your Medicaid be calling, like for example, I cover North Carolina, they have managed Medicaid plans, which are run by some familiar insurance plans like Blue Cross Blue Shield, United Healthcare, that sort of a thing, versus being directly run by the state itself. And state health insurance exchanges will screen applicants for Medicaid eligibility as well. So when you're going through the process to determine if you qualify for any of those premium subsidies, it asks you to enter your income. And so based on income, you may also be qualified for Medicaid eligibility, if not for a premium subsidy. And Medicaid eligible recipients typically have to recertify for coverage annually. Next slide. And now we'll discuss the differences between the different health plan categories. Next slide. So here are some acronyms you may have seen before, and we'll get into those in the next couple of slides. Insurance is just full of acronyms. Next slide. So the first acronym, HMO, that stands for Health Maintenance Organization. And these are managed care plans that often have prior authorization requirements in place to secure coverage for different types of services. For example, your plan might require prior authorizations for diagnostic testing, specialty drugs, or admissions to the hospital. HMOs also limit you to a local network of doctors and require referrals from your primary care physician to see specialists. And these plans often have lower monthly premiums compared to the other types of plans. Next slide. Next acronym is PPO, which is Preferred Provider Organization. These offer more flexibility and choice. They typically do not require referrals from your PCP to access care from a specialist, and offer an expanded network of physicians and healthcare providers. These plans provide additional flexibility by offering some level of coverage for out-of-network care. The premium costs for these plans may be higher though. Next slide. The third acronym is EPO, or Exclusive Provider Organization. These are very similar to your HMO plans. EPOs can restrict patients to a limited network of providers, but they may not require those PCP referrals to access specialty care. They also do not include out-of-network coverage. And then the last, next slide, please. The last type of plan is POS, which is point of service. These plans are kind of a hybrid that operates similarly to the EPO and HMO models, but may offer some out-of-network benefits and flexibility there. Go on to the next slide. When choosing a plan, it's important to keep cost, provider network, and your benefits coverage in mind. This is something that I always recommend to the patients I'm working with if they're in a position to be switching insurance or having a mandated change through their employer. You're always going to want to be obviously keeping costs in mind, but also keeping in mind if your doctor or your facilities that you utilize are in the network with your new plan. Let's go to the next slide. So this slide talks about the different costs associated with your insurance plan. So one of the terms we've mentioned so far is premium, which is the monthly cost for plan coverage. So premium costs can be shared between an individual and an employer or union if you have an employer or union sponsored plan. But if you're enrolling with individual coverage, you as the enrollee bears the entire monthly premium cost unless you're eligible for those premium subsidies through the health insurance exchange. Medicare beneficiaries also have premium costs, but Medicaid recipients do not. Premiums must be paid in full on a monthly basis to keep your plan active. Failure to pay premiums can result in cancellation of your policy, and an individual may need to wait for the next open enrollment period to secure coverage. And all plans are going to have some kind of cost sharing structure. These will include co-payments, which are the set costs for a given medical service, the deductible, which is the amount that an individual is responsible for meeting before your insurance provider covers any service, and coinsurance, which is the percentage of a cost that you're responsible for paying. One kind of simple example I like to give, because I'm not very good at mental math and sometimes we're dealing in really big numbers. Let's just say that your plan has a 20% coinsurance and you go visit the doctor, and going to the doctor costs $100. After you've met your deductible, your insurance will pay for 80% of that $100 doctor's fee, or $80, and you would be billed for the 20% coinsurance, or $20. So that's a simple example using $100. So that's one way to think about coinsurance. And some plans also offer the protection of an out-of-pocket maximum, which is the most that you would have to pay out of pocket in a given plan year. And those monthly insurance premiums, unfortunately, don't count towards that out-of-pocket limit. With the Affordable Care Act, it was made, all of the insurance exchange plans do have an out-of-pocket limit. It's very uncommon these days to find insurance plans that find commercial insurance plans that have no out-of-pocket limit. Medicare does not have an out-of-pocket limit, which is why it's usually important to have a supplemental plan with Medicare. And as a general rule of thumb, if we're looking at this image over here with the premium and deductible and the little money bags, plans with a lower monthly premium often have a higher deductible or an out-of-pocket maximum, and plans with higher monthly premium will have a lower deductible. So there's kind of a balance of how much you're paying out of pocket. It's either upfront with the premium and you have a lower deductible, or you pay less with your premium, but it takes longer, a higher dollar amount to reach your deductible or out of pocket. So that's one thing to keep in mind as well. We can go on to the next slide. And when evaluating your plan options for your next benefit year, you may want to evaluate whether or not all of the healthcare providers that are important to you and your family are in network with your plan, or it's important to understand how your provider's out-of-network status could impact your out-of-pocket costs. Typically, in-network is less expensive for you and your insurance provider. Out-of-network is going to be more expensive. So that's the general rule of thumb there. It's usually good if you can get in-network providers if possible. Go on to the next slide. And it's also important to fully understand the coverage and benefit structure of your plan to determine if it will meet all of your healthcare needs. Knowing your benefits and coverage will also help you assess and plan for your anticipated out-of-pocket costs for the plan year. Essential benefits that all plans cover include doctor's visits, hospital visits, preventative care, and diagnostic care. Prescription drug benefits plans may have formularies that change annually, and your copays for prescription drugs may change depending on tier placement. So you may have seen that in some of your insurance paperwork that different medications are tiered based on cost. And a formulary is a list of drugs that are going to be covered by your insurance plan, typically without a prior authorization. Most specialty medications will require a prior authorization, and they may not show up on that formulary, but it doesn't mean that they're not covered. Go on to the next slide. And when you're considering choosing a plan, you can work with your CareConnect PSS case manager to assist you with your decision-making process and information gathering. Some of these questions you might consider include, can I afford to pay my premiums and out-of-pocket costs? What does my plan cover? And can I get the services that I need? Will I have to change doctors or facilities? How much flexibility do I want in choosing a doctor? And are my prescriptions covered? Go on to the next slide. So now we're going to talk about different open enrollment periods, and we're currently in the midst of several of them. So we'll discuss that over the next couple of slides. We can go on to the next slide. So health insurance open enrollment is the time period each year where you can sign up or change your insurance plan. It typically occurs near the end of the year when your coverage and lasts for the next full year. So right now we're in the midst of the health insurance exchange open enrollment period. It's actually ending this Thursday, the 15th. Typically ends that the open enrollment period for the health insurance exchange typically runs from November 1st to December 15th every year. That can change, but that is the typical time frame. And the Medicare open enrollment period just ended last week on December 7th. That one typically starts in October and runs through the very beginning of December. But again, every year to year it can change, but that's the typical time period. And open enrollment periods for the different state insurance exchanges may be different, but that is the federal open enrollment period for the health insurance exchange is ending this week on Thursday. And excuse me, and it's important to look at this bolded statement. It says in most cases, if you don't sign up during open enrollment, you would have to wait until the next open enrollment period unless you experience a qualifying life event. So we'll talk about that in the next few slides. If you want to move to the next slide, please. We can go to the next one. Awesome. So some life changes that can affect your health insurance and may trigger a qualifying event could include changes in employment status, so starting, changing, or leaving a job, changes in family status, getting married, having or adopting a child, getting divorced, moving to a different state or country, or age milestones. So in some states, when a child turns 18, they may lose coverage through Medicaid or the Children's Health Insurance Program, or CHIP. Turning 26 can be an age milestone. Federally, individuals under the age of 26 are able to stay on a parent's insurance policy until they turn 26, and then turning 65 qualifies anybody for Medicare regardless of disability status. Go on to the next one. So if you have one of those qualifying life events, it would trigger a special enrollment period. So most of the time when you have a special enrollment period, you have 60 days to make a change in coverage. However, it's important to understand all of your options and timelines. In most cases, if you don't secure alternative coverage during that special enrollment period, you could risk having a gap in health insurance, meaning having no coverage until the next open enrollment period. Again, very important to work with your case manager if this is something that you're anticipating could happen to you, having a special enrollment period. And your case manager can also help you understand your potential COBRA benefits if you lost employer coverage. Go on to the next slide. So just want to, as we wrap up the presentation, just wanted to go through some of the different resources available to those enrolled with the Sanofi CareConnect PSS program. Move on to the next slide. This is a bit of a repeat from before, but just talking about how participation in CareConnect PSS is free, voluntary, and confidential. It's absolutely free of charge. It's an opt-in service. And then can move on to the next slide. So your CareConnect case manager can help to coordinate care, and we're all very passionate about our work with patients. We're committed to helping patients gain access to medically necessary treatment as well as medical specialists to help manage your disease. We work one-on-one with patients and families to provide a highly personalized level of service. We support patients by providing education, advocacy, and supporting collaborative partnerships. And we're dedicated to educating and connecting patients and their family with all resources available to them. And so we're available to patients throughout their diagnostic and treatment journey, and we definitely understand how overwhelming all of these insurance issues can be. So we're here to help you navigate through this so you don't have to go through it alone. You can move to the next slide. And the CareConnect PSS Patient Education Liaison is a team member partnering with the case manager. The PELs are regionally based, and so they are accessible to patients and families in the area. So at the very beginning, Tiffany had mentioned that I'm based in Boston, Massachusetts, as are most of the case managers, but the patient education liaisons are based all around the country, live in the territories that they cover. So you have somebody local to you that can come out and meet you in person if you need. PELs educate patients and families about disease and inheritance. They work one-on-one with individuals to help support healthcare decisions, can help patients understand how your disease may be passed on and through families and complete a medical family tree. And typically are nurses or genetic counselors by background. And we can go on to the next slide. So some of the other programs that we offer with CareConnect PSS include Journey Ahead, which there are two different Journey Aheads that we offer. One is for young adults or adolescents from ages 16 to 26. It's the goal of these programs are to help young adults navigate the transition from childhood healthcare to adult healthcare, helping educate you on insurance, what it's like to take care of your own health journey now that you're an adult. We also have another Journey Ahead program that is aimed at individuals approaching Medicare eligibility. So it's designed to help you navigate the sometimes very overwhelming Medicare enrollment period, and how your healthcare insurance could change when you elect Medicare. We also have another series of programs called Perspectives, which is a program we offer for patients and caregivers and provides a space to share and support each other in discussion on a variety of topics, which include living and coping with a chronic illness, parenting a child with a chronic illness. There's another program on self-advocacy and self-empowerment, and another one on self-care. And we also have a newer program designed to help individuals discuss strategies on communicating health information to family members, especially when you might have a diagnosis that runs in families. And those can be difficult conversations. Go to the next slide. This just shows some of the resources that are available on our website, which is there in the green box. We have podcasts, webinars, ways to connect with your case manager. There's lots of different videos and digital content there on the website that we encourage you to check out. Go to the next one. We also have different newsletters that are disease specific or just about CareConnect in general that you can come and receive through email. And then the last slide. This just has some information on how to connect with a case manager if you're not already connected. Our 800 number and the general email address is listed on this slide, but if you aren't sure if you're already connected with our program, I can put my email in the chat in case that's helpful. If you want to reach out to me directly, it could help get you connected with the right person. But again, your case manager is just a phone, text, or email away. And that is my presentation today. Happy to answer any questions.
Thank you so much for that very informative presentation. It really, I think, shed some light on insurance, which I'm sure I'm not the only one that hates dealing with insurance.
Should really be taught in high school. I feel like it's one of those things like taxes, how to write a check, those sorts of things that we just don't all get enough information on.
I completely agree with you on that one. You mentioned Journey Ahead for younger individuals. Do you have a program for those that might be older and transition into Medicare?
Yes, we do have the one for Medicare as well, and that can definitely be delivered if requested by your case manager. I know that we try to present that one in the fall, like before the Medicare open enrollment period, and people as case managers, we like to keep track of who is kind of around that age that we may want to invite to that program. But if there's a request, you can definitely reach out to your case manager or me, and I can connect you with the right person if that's of interest in being presented in your area.
Sure.
We have the ability to do that virtually or in person.
And what about people that, have been in the workforce but are feeling that their condition has progressed to the point where perhaps it's time for them to stop working and to apply for disability? Is that an area that y'all can help with? Because
it's a great question. Yeah, absolutely. I actually just worked with somebody this past fall on that very thing. This individual was in their 40s, but was considering leaving the workforce for that very reason. So we, as CareConnect case managers, many of us have backgrounds in social work or nursing. I think I forgot to mention that. So a lot of us do have expertise in helping navigate those systems. While we're not disability case managers ourselves, we can help get you pointed in the right direction on how to initiate that process. And there's a lot of really great community resources as well that we can help locate those for you. I also feel like the Medicare Journey Ahead to Medicare talks about that a little bit too, because the reasons why somebody may be looking to elect Medicare may fall under the umbrella of applying for disability. So anytime you may be thinking of having a change in employment status or anything that may be impacting your ability to retain the same health insurance you currently have, that's a great time to talk to your case manager so they can help you navigate what your options may be.
Yeah, I think that it's definitely a problem, especially changing jobs, as you mentioned, and the COBRA situation, and especially if you have a doctor that you particularly want to stay with.
Absolutely.
Network, and that can be challenging.
Definitely. And COBRA in and of itself is just kind of an overwhelming undertaking to understand all the ins and outs. And with COBRA going into effect, the way that COBRA works is your benefits stay the same if you elect COBRA. However, the cost for your insurance goes up significantly. So that can be a place where your case manager can help navigate what your resources may be on helping afford those costs as well.
Yeah. If anybody else has some questions, please don't hesitate to share in the Q&A box. I know a lot of times when we get questions, it's very specific to the individual, which would be very hard to answer in this format. So I think usually, we do as you suggest and recommend contacting a case manager that can really drill into that specific situation. And I think maybe one of the things that wasn't touched on too much is that state by state, there can be so much variability.
Absolutely.
Yeah, so we hear sometimes patients saying, well, I have this and it says that. Well, it may depend on where you live, right?
Exactly. We touched on this super briefly about the Medicaid expansion. Every state is going to be really different. I live in Massachusetts, which has a very expanded Medicaid program, but I cover a state that doesn't. So it's even navigating, like knowing what's available where I live versus what's available for the patients I work with, can be very different. And, I've covered others. I previously covered Kansas, Nebraska, and Illinois, which again, all have very different insurance landscapes. So that's a great point. And even year to year, the plans that are offered in a given state aren't always the same. There can be new plans entering the marketplace. There can be plans pulling out of the marketplace. So typically, with the health insurance exchange plans, you will typically be able to re-enroll in your same plan the following year. If you like that plan, most people will get a letter in the mail stating that you can be re-enrolled. However, if you're ever interested, it's worth looking to see what new plans may be available. You may be able to save a little money on your plan, or there may be opening up a different network of providers for you. So you don't necessarily have to roll into the same plan year to year, but it's worth checking out what you qualify for, just because things can change with every year.
Yeah, that's a really good point. And, this is just a personal question as kind of a forward-looking question. Do you see any major changes in the insurance landscape? Within the last 5 to 10 years, there was the big change with, the Obamacare and all of that. And that really opened up a lot of options, in my opinion, for rare disease patients. But
absolutely.
Do you see any changes coming, or pretty much status quo?
As long as the Affordable Care Act remains upheld by our politicians, I don't see that changing. We typically will have, it'll be on the news if it's up for debate or repeal, but I don't see that going away anytime soon, just because, like you mentioned, it is providing healthcare options to pretty much everybody. And the other thing is, with the passing of the Affordable Care Act in 2010, they wrote into that law that people who don't have health insurance will have to pay a penalty on their taxes. So every year when you get all your tax statements, you're usually getting that one form that will say, yes, I had health insurance for 12 months of the year. If you don't have health insurance, you're going to have to pay a tax penalty. So they'd have to repeal that as well. So technically right now it is legally mandated, federally mandated, that everybody should have access to health insurance through this exchange. And obviously there are people that do not have health insurance, but they are supposed to be paying that tax penalty. So I guess the short answer is no, I don't see any big changes on the horizon.
There's no other legislation or major increases in health insurance that you see coming?
Not that I'm aware of right now. I know that there are different pieces of legislation going through Congress that are changing some of Medicare laws and Medicare coverage of different drugs. But that is only going to impact individuals with Medicare coverage. I think the federally, not a huge amount of changes, but I think what it's more important to pay attention to are changes with your individual state. As states pass laws on different Medicaid expansion, that can open up Medicaid eligibility to more people, especially individuals who may qualify as disabled, children especially. I can say in my state, or my territory of North Carolina, they just enacted managed Medicaid plans in 2021, but in April next year in 2023, they're rolling out another program that's going to expand different benefits and access to certain groups that may qualify for higher levels of Medicaid resources. So I think on the state level, there's more change than there is on the federal level.
That's good to know. That's helpful. I think, of course, with all of us in the community, insurance is something that we're very conscious of and concerned about because of how expensive treatment is, and, not just treatment itself, but everything that goes with it. So
And I think another thing that the case managers also keep a pulse on are the different patient assistance programs and foundations that may be available in the community for different individuals with rare diseases. And those can change from year to year. There may be new resources available from year to year. So we try to keep, we have available to people a disease specific resource letter that we're able to provide to you, which may have some information on, new foundations and new areas of financial assistance that we try to keep tabs on that. So if you're ever in need of resources, definitely reach out to your case manager and we can help provide that information. So we try to keep a pulse on that as well.
Thank you. That's definitely very, very helpful. Are there, if there aren't any other questions, and remember, type them in the Q&A box if you have any. All right, it looks like there aren't any questions. So I want to thank you very much,
Sure.
Amy, for your participation in today's webinar. It's been incredibly informative, and I know the community really appreciates your time.
Absolutely. And again, I put my email in the chat. So if you need to connect with your case manager and you're not sure how to do that, definitely shoot me an email and I can help get you connected with the right person. If you have like a more specific individual question, I'm happy to help make that connection.
Thank you, Amy. And with that, this concludes today's AMDA webinar. And I want to thank everybody for attending. Have a great day.
Thanks so much.
Bye.